Head, neck, eyes, ears, nose, and mouth assessment. First we need to do is hand washing. And of course, the gloving. After we go to our patient, we should identify our patient, and of course, we need to provide them a privacy by closing the door or any curtains. Inspect the head and face. First, we need to assess for the normal size, shape, and symmetry of head and face. And then, look at the patient's hair quantity, distribution, texture, and color. The hair should not extremely dry or greasy. And then, palpate the patient's skull and look for any masses, lumps, or any skin breakdown. Then, palpate the temporal arteries, and the palpation should be equal. Using stethoscope, listen for the temporal arteries bruits, and it should not be present. Because due to the presence of bruits, then there will be an abnormalities to the patient. Now, press your thumb under the inner orbit to palpate the frontal sinuses. Also do this to the zygomatic bones to palpate the maxillary sinuses. Then percuss these areas and ask if the patients are feeling any pain or tenderness. Using middle finger to palpate the temporal mandibular joints of your patients, instruct them to open and close their mouths, and joints should be moved freely. And this is to test the motor function of the trigemital nerve. To test the patient's facial muscles, instruct them to raise and lower their eyebrows, smile, frown, bare their teeth, pop out their cheek, and to keep their mouth closed as you try to open it. As the patient's sensibility, instruct the patient to close their eyes and to let them know or inform you if they feel something that touch them. Touch the forehead sides, the cheeks, and the jaw. Now we're going to assess the eyes. Test the patient's visual acuity with the Snellen's eye chart. And if they are wearing corrective lenses, then they can wear it through the testing. With the patient standing 20 feet from the eye chart, instruct them to keep their both eye open and cover the other with the card while reading the chart. And the normal vision is 20/20. And then, we must record the patient's record for each eye and know whether they are wearing corrective lenses. And we're going to inspect for the patient's eye. The eye should be symmetrical. The eyebrow should be free from lesions or scaling. The eyelid should partially cover the iris, and the eyelashes should be upward. Test ocular motor nerve by asking our patient to close their eyes, and eyelids should move symmetrically without tremors. Then palpate the eyelids for nodules and tenderness. For testing the conjunctiva, the patient must look up and we need to overt the lower lid. Then ask the patient to look down as you pull out the upper lid to inspect the upper conjunctiva and sclera. And then palpate below the orbit and apply a little pressure. Next is to check for the patient's extraocular movements. Place the fingers at 12 inches away from the patient's eye and instruct them to watch your fingers as it moves upper right, front right, lower left, front left, and upper left. Then hold your fingers 4 inches away from the patient's nose and ask the patient to look at your fingers, the wall behind you, and to look at your fingers again. Pupils should constrict as they focus on your fingers. And now, ask the patients to stare at the walls behind you and have them cover their one eye and observe the uncovered eye. It should not move. If they remove the card, watch the eyes that been removed and there will be no movement of the eyes. Inspect for the patient's cornea and then test for the corneal light reflex. Then instruct the patient to look forward as you shine the light into the bridge of the nose from 12 inches away. If both cornea reflects the light in the same spot, then the eyes are properly aligned. Inspect the pupils. The normal should be 3 to 5 millimeters wide and equally round. Assess the optic and ocular motor nerve. Darken the room and shine the light from one pupil of the sides, and normally it causes both pupils to become smaller. Document the findings as perla means pupil equal round, reactive to light and accommodation. Assess the internal eye structure using the ophthalmoscope. Ask the patient to look at the object as you bring it closer to the nose. Now we're going to assess for the ear. Now, inspect and palpate the ears. It should be symmetrical without swelling, lesions, thickening, or pain.
There is any tenderness.
And then, palpate the mastoid muscle behind the ear, and the patient should not feel any tenderness. And for otoscopic exam, my patient is adult and I'm going to pull the auricle up and backward to straighten the ear canal, and if our patient is child, then pull it down and backward. Then inspect the external ear canal for any lesions, redness, swelling, and edema. Then, inspect the patient's hearing by performing the Boyce-Weber and Rini test. Put your finger to the one ear of our patient and then stay away from the patient 1 to 2 meters away. And then have them close their eyes as you wiggle their ears and whisper 2 words and let them repeat it. So now, we're going to perform the Weber's test for us to assess the sound transmission to the skull bone and use our tuning fork. Hold the tuning fork and strike it with your fingers and place the vibrating tuning fork to your patient midline and the patient's skulls. And the patient should hear it equally in both ears, which means that their conductive hearing is normal. After that, perform Rini test, which it can detect if the patient have conductive hearing loss. Strike the tuning fork and place it in the mastoid process, then count the seconds until the patients can no longer hear the sound, and this indicates the bone conduction. Then immediately place the vibrating tuning fork close to the patient's auricle. Count the seconds again until the patient said he can no longer hear the sound, and this indicates the air conduction, and this is usually long compared to the bone conduction. Now we're going to assess the nose and mouth. Inspect and palpate the external part of the patient's nose. And then, ask the patient to cover the one nostril as they inhales and exhales, and the air should flow freely. And then we're going to test the smelling of our patient. What kind of smells that?
Neptune.
Now we're going to inspect nasal cavity using the otoscope with the speculum. Now, we're going to tilt our patient's head slightly and insert the speculum gently into each nostrils and apply gentle pressure on tip of the patient's nose with your thumb. To assess the jaw alignment, ask the patient to bare their teeth, and the upper teeth should override the lower teeth slightly. Ask the patient to close their mouth and it should close symmetrically. Palpate the lips and it should be smooth and soft. Now we're going to instruct our patient to open their mouth. And then assess the oral mucosa. It should be pink, moist, and smooth. Assess also the patient's teeth and gums. 32 teeth for adult, bony and whitish for hard palate, muscular and pinkish for soft palate. And then palpate for any tenderness or lesions. And note for the size and shape of it. And now we're going to test the power of the tongue of our patient. Apply pressure to the patient's tongue to the right and let them resist. And do it to the other side. And then let our patient stick out their tongue and let it go upward to see the veins underneath the tongue. And then instruct the patient to stick out their tongue and say ah. And the uvula should be pink. After that, we're going to remove our gloves and as well as do the hand hygiene so that we can't harbor any microorganism that comes from our patient's mouth. Now we're going to assess the neck. Inspecting the neck. The neck should have symmetrical muscles without any swelling or masses. If there is swelling below the jaw angle, then palpate for parotid gland problems. And now, we're going to assess for the active range of motion of the neck. Going to instruct our patient to touch the chin to the chest. Turn the head to the left and the right. And then, tip the head against the right shoulder and left shoulder. And the last is tilt the head backward. This movement should be smooth and painless. And now we're going to assess for the spinal accessory nerve. Apply resistance to the shoulder of the patient as they fight for it, and it should be symmetrical and they must be able to resist. Turn your patient head to the side with pressure as they are resisting, and the movement should be equally strong. Now we're going to palpate for the lymph nodes by using circular motion. Preauricular, posterior auricular, occipital, submental, submandibular, tonsil, superficial cervical, deep cervical, posterior cervical, and supraclavicular. We must note for the size, mobility, shape, consistency, and tenderness of the nodes. The normal nodes are soft, small, non-tender, and movable. Check for jugular veins and let the patient lie down with supine position, and their head should elevate to 30 degrees and turn their head away from you. Observe the palpation of jugular veins and with the inspiration and note for any unusual palpation. And after that, we're going to let our patient sit down and identify the trachea by locating the sternum notch and slide your fingers on each side. The trachea should be symmetrical and midline. Use your left hand to push the thyroid gland to the right and curve the fingers of your right hand between the trachea and sternocleidomastoid muscle. Ask the patient to extend their neck and swallow. You should feel the thyroid from up and down as the patient swallows. And then, we're going to palpate the thyroid gland from behind of the patient. And we're going to give our patient a glass of water. Go behind the patient and place both of your hands on the patient's neck with your index finger under the cricoid. Palpate both lobes and the isthmus. Instruct the patient to sit and swallow during the exam. And we're going to note for the size, shape, and consistency of the thyroid. And if the thyroid is enlarged, then auscultate for bruits with the bell of the stethoscope. And then observe for the carotid artery. Palpate for it gently by using your index and middle finger. Then instruct our patient to have a deep breath and hold it as we auscultate the carotid artery with the bell.